This module will give you an overview of assessments fluid balance in PowerChart and FirstNet. This is also known as iView, and it is where discrete results can be recorded for clinical assessments and activity. For example, falls assessment, recording vital signs manually, and insertion of devices such as IV lines, surgical drains, etc. We will show you how to record an assessment and also how to modify an assessment. Assessments fluid balance can be accessed through the vital signs component of the workflow by clicking the heading. The sections shown on screen are known as navigator bands, and each of these bands contains relevant assessments. The pencil icon gives you the option to customize the band you have selected. For example, if you wish to have news and vital signs on show each time you click Adult Quick View, you would click the default open box, as we have done here. You can also choose which assessments are on view within the band. For example, additional measurements is currently not on view, so by ticking this box and clicking OK, we can choose for this to be visible within the band. The default view shows data recorded within the last 24 hours. Right-clicking on the banner will give you the option to choose a predetermined time frame. Clicking Other will give you the option to set a specific time frame if you wish. The screen currently shows assessment intervals of 1 hour. Right-clicking on these allows you to change this interval. Here we are changing the interval to 15 minutes. By right-clicking, you can also insert a specific date or time. For example, here we are entering 12:12, and this will insert a column for results to be recorded at that time. This can also be done using the icon shown here. The clock icon allows you to see all overdue tasks for the patient and record these as complete or not complete, as you would in Care Compass. One of the key features of assessments fluid balance is how it links to different parts of the EPR system. Entering certain results will trigger different alerts or information to appear. We will now demonstrate a few examples. Within the Adult ICU Lines Devices band, we can enter a patient's ventilation details. For training purposes, we will not complete all details, but by selecting Ventilator Initiate Activity and entering the ventilation details, you will trigger a change in the critical care work list. Here you can see that the information we have entered generates a ventilator mode icon. Equally, using assessments fluid balance to enter a ventilator discontinue activity will remove this icon from the critical care work list. Another example is when completing the falls assessment within the Adult Systems Assessment band. Inputting yes for is the patient at risk of falls will trigger the Fall Prevention and Management care plan to be added as a suggested care plan to the patient's record. Here we can see this shown in Care Compass. We will now demonstrate inputting information for particular assessments and show you how to modify an assessment.
So we're going to double click time cell at the top of the column to activate cell below for documentation. And I'm now going to enter 16 for respiratory rate. For peak flow, I'm going to enter 320. For peak flow recorded, I'm going to choose pre-nebulizer. We're now going to click Sign, the green tick. I'm now going to look for fall assessment, so I'm going to click on fall assessment, and I'm going to double click the blue cell under the appropriate time column on the fall assessment. For patient age, I'm going to choose less than 65. For fallen within the last 12 months, I'm going to choose yes. And I'm going to choose 1/2, and I'm going to choose no. I'm going to select steady gait. I'm going to select no. I'm going to select no. I'm going to select yes. I'm going to select yes. I'm going to select yes. Visual impairment affecting safely? No. I'm going to select no. I'm going to select no. Is the patient at risk of falling? I'm going to select yes. Patient able to use cord bell? I'm going to select yes. Can bell within patient reach? I'm going to select yes. Design version check? Yes. Hearing aids? Yes. Rounding toileting? Yes. Appropriate footwear available? Yes. Refer to physiotherapy? No.
For the request medication review for fall risk, select no. Measures taken to check patient, select monitoring bay. Supervision required, select when mobilizing. For the specialist falls equipment, select ultra low bed.
Once we've done that, I'm going to now click on sign. And the fall risk alert appears. In Power Chart, select vital signs in the workflow. Click plus next to a drop-down arrow. Click Adult System Assessment tab on the left. Click Oedema Assessment that now has a tick next to it. Identify the item you want to modify. Right-click. Click Modify. The drop-down is open for that question. Deselect 2 plus mild / 4 mm and select 3 plus moderate / 6 mm instead. Click Sign. A triangle appears next to the value in the cell to highlight that the details was modified after signing. If you record on a wrong patient, you can right-click and unrecord an individual item or the whole set of documentation. You need to provide a reason for unrecording.